We're good to go.
Hello everyone, welcome to our nursing webinar session. As you all know, we are discussing about heat related medical emergencies, and today's topic for discussion is emergency management of dehydration. Having said that, we have with us Dr. B. Vijay Kumar Garu, who is our senior consultant physician from Secunderabad unit, Yashoda Hospital. I welcome you, sir. We are privileged and honored to be here with you all, and then we want to share the session. Yes. And also, sir, unmute yourself. And also, we welcome Miss Alice Joseph, who is here as a senior nurse manager as a speaker today.
Thank you.
And start sharing the slide. So the first topic and the first awareness we would like to understand from you is, sir, unmute yourself, sir. Yeah, as we are talking about dehydration, is a dehydration life-threatening emergency? As you know, the frequent cause of hospital admission is about the dehydration. So we wish to understand from your point of view, sir.
Yeah, you're able to hear me?
Yes, sir.
Yeah, as we all know, water is the lifeline of any living creature. Subsequent slides, madam will tell what is the composition and everything. But in cases of dehydration, because body is a source, it's run by intercommunication between cells, between various organs. It is almost like an electrical circuit. And the medium for this conversation between different organs, different cellular systems, and the body functioning as a whole is through water and its electrolytes being the medium.
Yes.
They are involved in so many communicating system proteins, messenger proteins, and also transport proteins between the cells and the other organs, by which communication occurs and the functioning happens. Any derangement in this process because of dehydration will affect every cell in the body. That means every organ in the body can be affected. So then it leads to so much of morbidity. And if they already have comorbid conditions like diabetes, hypertension, renal disease, cardiac disease, or stroke, those will be augmented, and sometimes they will become life-threatening, and we may lose the patient also.
So let us also see what we have in the rest of the session. Alice, over to you.
Good afternoon, all. Yeah, let's see today's session. First of all, we have to understand what is dehydration. Mostly occurs when the body loses more fluids than normal, leading to an imbalance in the body's electrolytes, such as sodium and potassium.
So yes, here again, we would like to, you can just go to the second slide. Yes. So sir, as we can see the fluid distribution, total body water and fluid is composite of 60% and more. So how does fluid loss leads to dehydration?
Yeah, as madam has told, that 60% of the body in males and about 55% in females is water. And out of this, almost 2/3 of which is the intracellular, that is within the cells.
Yes.
And the rest of 1/3 is the extracellular. Again, in the extracellular, 80% of it is between the cells, that's called as interstitial. And only 20% of that 1/3 is the intravascular volume or the blood volume. The blood volume, which is 5 to 6 liters, actually is 20% of the extracellular volume, and it comprises only 5% of the total body content of water. That's what we measure in blood pressure. That's the circulating fluids, about 5%. So dehydration is imbalance between what we take in and what is put out. The way we lose water is through 3 major portions. One is through the GI system, one is through the kidney, and the other is insensible losses through skin, lung, and other tissues. So if the input does not match the excretion because of any reason, the output from GI tract or urinary system, the skin is in excess of what is normal and is beyond the input that is happening, then you get dehydration.
Now let's see the causes of dehydration. It's like factors like heat exhaustion, heat stroke, insufficient intake of fluids, excessive sweating, vomiting, and diarrhea, etc.
So as we are just looking at the point, are these causes of dehydration, or are there any major causes as well to have the dehydration in the patients, among the patients?
Yeah, common causes as probably in succeeding slides we may see,
Yes.
dehydration is more common in extremes of age, young children, infants, and elderly. The reason being the amount of body surface area is more in infants. The mechanisms to control the excessive loss are lost in the elderly. And the volume of fluid also, as we age, decreases from 60% to less than 50 to 40%. So any minor losses caused there. The commonest cause in children, of course, is diarrhea and vomitings. That is the commonest. Then second common causes are infections like pneumonia, which causes more heart, more breathing, losses through the lungs, losses through the skin. Those are extreme. And in adults, as you said, again, vomiting, diarrhea, excessive sweating, and less intake of fluids. This is the most common cause. And especially in summers, if they go out when there's too much of heat and humidity, if you're not taken adequate liquids, then it's a problem. And it's a common thing we see that especially women, if they go out, they don't take water because they have to find a proper restroom to pass urine. So that is the limitation. So there's so many other factors which also limit your fluid intake because of your professional thing, or you're not able to take because of your duty or whatever it is.
Yes.
So one of the major issues there is continuous hydration irrespective of the situation is a must.
Yes.
Generally, when your kidney and heart are good and you're young, most of the times dehydration doesn't happen because we tend to take adequate water, which is usually compensated by the kidney. So other causes of heat loss other than this is, for example, if you have a chronic kidney disease, then you tend to lose water.
Water. Yeah.
And some of the endocrinological diseases like diabetes insipidus or newly diagnosed diabetes also causes excess loss of water. And if you have skin diseases, which like eczema or anything else, which causes a lot of water loss through the skin also. So chronic skin disease also can cause water loss.
Water loss.
And burns patient, the requirement of water increases 3 to 4 times because the loss through the skin is very huge. And there are some lung conditions which can also cause water loss by excessive breathing and also loss of protein and a lot of mucus, especially in patients like bronchiectasis and other things, there's significant loss. The last but not the least is chronic GI disorders where we'll have chronic diarrhea, protein losing enteropathies. These can also cause water loss. One other thing which nurses and especially us should notice is third space losses. For example, if patient develops ascites or pleural effusion or some third place loss also, that also should be taken into account.
Yes. Very well acknowledged.
Yeah.
And very good point, sir. Yes.
Now let's see who are the people most affected with that the infants, young children, the outdoor workers like traffic police and farmers, and patients with medical conditions like those who are on diuretics and chronic kidney diseases, and people with limited access to clean drinking.
So I think sir has already discussed which medical conditions like CKD, renal and GI disturbances on chronic illnesses would definitely cause the dehydration. I think yes, sir.
Yeah.
Yeah.
Now let's look into signs and symptoms. It's depend on the severity of the dehydration. There will be intense thirst, dry mouth, decreased and dark colored urine, fatigue, mild headache and tachycardia, sunken eyes. Mostly we can see it into pediatric group, and irritability. Even a loss of consciousness and fainting can be seen in severe cases.
So having looking at these symptoms, are there any subtle signs of dehydration? Sometimes we may not, identify the signs of dehydration. So
Yeah. So one of the things before we go into the subtle sign I would like to tell you is dehydration is a diagnosis by physical examination. So nurses are the best ones and they usually do that. Laboratory tests only to look at the complications.
yes.
But physical examination tells us mostly the diagnosis. So usual subtle signs in adults are one, reduction in the passage of urine and mild dizziness and especially postural giddiness. Once they get up, they'll have giddiness and fatigue. These are the earlier signs which we can have in
Yes.
initial dehydration. Subsequently, as Madam has said, dry mouth, increased thirst, fatigue, cramps, then palpitations, increased heart respiratory rate, and slight reduction in mentation, confusion, all these things set in.
Yes.
Now let's look into types of dehydrations. Isotonic dehydration. The loss of water and electrolytes from the body is proportional. This is the most common type of dehydration. There are hypotonic dehydration, mild, moderate, and severe dehydrations.
So, sir, which type of dehydration is both like common in nature and severe? And maybe you are witnessing nowadays many patients coming to OPD for the daycare interventions and going with some prescription from your end. So, what is your take on this, sir?
Yeah, as Madam has said, three common types, isotonic, hypertonic, and hypotonic are the medical terminology for the common type of dehydrations.
Yes.
Isotonic dehydration is the most common, where both water and sodium are lost equally. And this is the common cause which we see in diarrhea, vomitings, urinary losses, infections, common burns and everything. These are the common ones. And this is the most common. So almost 80 to 85% are isotonic losses. The good thing about isotonic losses is once you replace just the volume, fluid volume, the patient is able to drink in water. You can water and routine electrolyte solution will help, and that will solve most of the issues. The hypertonic ones where the water is lost, sodium is not lost that much. This happens especially in conditions like affecting the lung or affecting the kidney, and usually pathological parameters that affect them. Those preserve the sodium, so the osmolarity in the body increases. So more amount of sodium is there. That will lead to some of the pathological features. Here, half strength only fluid replacement is important rather than electrolytes and other things. The third type of loss is hypotonic, where the sodium goes out. This is a little bit dangerous because once you lose sodium, the water from the extracellular compartment goes into the intracellular cells, and the cells balloon out. So there's edema of the cell. Edema of the cell leads to decreased function in every organ, more so in the brain, and it can cause seizures, loss of sensorium, and also unconsciousness and coma. So here the common conditions usually are because of drug related. One are diuretics, which we commonly use in many patients, and some of the psychiatric medications, and some of the conditions like uncontrolled diabetes or diabetes insipidus, or all these things where more of sodium is lost compared to water, and you'll get hyponatremia. So hyponatremic dehydration is slightly more dangerous because it can lead to seizures, coma, and other things.
Yes. So, sir, one common doubt I wish to ask, like many people or maybe healthcare professionals also, they are scared to take water because they think frequently they need to go for, urination. And
Yeah.
while doing so, they lose maybe this hypotonic conditions. They must be losing the electrolytes also. So what should be, message or advice to them? What we should tell them? Like, should not they consume frequent water? Because again, they say ki we feel excessive tired and fatigue like that. So
One of the misconceptions is that
yes,
water intake, at this point, we would like to stress adequate water is good for the body. For example, one simple thing is what are things which are considered good for your health, foods wise. Those foods which contain water, like vegetables and fruits,
yes,
which they contain a lot of water, are good for our system. That is because in addition to the adequate energy giving products, they give adequate water. So water is the essence of life. Frequently sipping a little bit of water is always essential, and that prevention of dehydration is much more better than ending up dehydrated after a period of time.
yes.
So good amount of water in spite of urination probably is a good thing to do.
Follow with yes.
Yeah.
Now it comes to the most important part. It's the nurse's role in the emergency management of dehydration. IV bolus, cannula insertion, and rapid rehydrations, which allows the rapid delivery of large volume of fluid directly into the bloodstream. So an adult weight 70 kg, 70 kilogram, the initial bolus should be approximately 1400 ml.
So what is the significance of intravenous IV fluids in achieving rapid rehydration? As we can look at this slide, like initial bolus, like whenever patient comes to ER and the emergency nurse should be able to, identify this sign and should be ready to give bolus. So what is the significance? Yes.
Like any emergency, ABC of management is important. First, stabilize the airway.
Yes.
And next, look at the breathing pattern, whether any obstruction. Then the circulation. Circulation, the volumes which Madam has mentioned are for severe dehydration, where there is a drop of blood pressure also, and where the patient is not able to consume oral liquids. So for initial management of severe dehydration, where the patient is quite sick, these volumes do hold. In children, basically the amount of dehydration measured by means of weight loss. The child has lost 3 to 5% of weight, then it's called mild. 5 to 10% of his original weight, it's called as moderate. More than 10%, it's called as severe. So if you know the previous initial weight, then recording the weight will tell us how much fluid the baby needs. So if it is severe dehydration, then in a baby, 100 ml per kg within the first 3 hours is important. So if it's a child.
Yes.
In adults, as Madam said, if average 70 kilograms, probably 20 ml per kg is the initial resuscitation dose that is required, which should be given in the first initial 3 hours. Then depending on how much is the urine output, how much is the BP is improved, how much are the other things, then you can supplement further every hour. 2 things to remember in adults are if the patient is a heart failure patient or if it is a chronic kidney disease,
yes,
they'll not be able to take that much load. Here also replacement of fluid is important, but it should be given in small boluses. You assess every 1 hour and give small amounts of liquid over a period of time, unlike giving suddenly a full bolus. So those are 2 caveats where you have to look at whether the patient is having heart failure or a kidney disease.
Kidney disease.
In adults, one more thing is you should be able to assess whether the dehydration or low blood pressure because of water loss or blood loss. If blood loss is there, only has to be given. Water should not be given. So the only way to assess is again any sudden fall in hemoglobin or GI if you're suspecting any melena or any external loss is there, that has to be seen. So we have to check for that, blood or water, especially in elderly.
Nursing initial assessment, which includes vital signs, BP, heart rate, respiration and temperature, to assess the severity of dehydration and obtain any symptoms like a fever or any recent illness. Also assess the fluid intake and output. 24 hours urine output is very much crucial. Physical examinations to assess the skin turgor, lethargy, confusion. In severe cases, we can identify the sign of shock. Laboratory test includes CBP, urea electrolytes, creatinine. It's a must. If there is any critical values, must be escalated to the doctor.
So I think these are the very primary nursing interventions. So one nurse must not forget and should do back to back in terms of patient safety. Yes, Alice.
Next slide. Yeah.
So let's see the image, how to check the skin turgor. Skin with a decreased turgor remains elevated after being pulled up and released. So if it is flat, that means patient is hydrated well.
Yeah, most of the children and adults probably this holds good. Only problem is elderly when you lose the subcutaneous fat. We cannot measure the skin turgor by this method because anyway skin will be very lax and loose. But still, it's a very good measure to check it.
To identify, yes.
Next slide.
So in acute dehydration, the 24 to 48 hours is very crucial. It can be fatal. So monitor fluid and electrolyte, and correcting the electrolyte imbalance is vital. And the choice of IV fluid is isotonic and crystalloids. So along with this, we can correct electrolytes imbalance as well. So continuously monitoring intake and urine output, loss of level of consciousness by using GCS. If the patient condition is okay, we can encourage oral intake. Frequent small liquid intake also advisable. If the condition is deteriorate or any respiratory distress or sign of shortness of breath, we can start oxygen therapy and maintain circulation, airway and breathing. Also, we need to closely monitor to prevent hypothermia or hypothermia. So monitor the sign of shock and it should be documented and should be escalated.
So, sir, I think are these mentioned fundamental nursing care for patient with dehydration enough?
Yeah.
Yes.
Yeah, most of them are steps that you have a formula to deal with them. Most of them, these are the parameters which we should be watching, and depending on that, escalating the treatment.
Yes.
And the thing is, the solutions that we give, initially, most of the times, ringer lactate is given because it contains adequate amount of bicarbonate and also some potassium. Things to consider is you should not pump in too much of ringer lactate, otherwise you might have alkalosis because of bicarbonate. And in people with kidney disease, because this also contains a lot of potassium, you should watch the potassium values also. Otherwise, it's a very good solution initially to correct acidosis, to start the circulation, and to improve the microcirculation. That's a good agent. Subsequently, you can switch over to protein normal saline or dextrosaline, which are good enough. And as Madam has said, once the patient is able to take orally, if the consciousness level is good and if there are no vomitings, encouraging oral rehydration is very good.
Alice.
While administering crystalloids, we have to be very careful. Rapid volume repletion may cause rapid rise in sodium. The patient volume status and the serum sodium must be followed closely.
Yeah.
Yes. Any potential adverse effects we need to watch, sir.
Yeah. One of them, this sudden infusion of fluid and causing sodium regaining very fast and causing the brain function abnormality called as central pontine myelinosis. It occurs mostly in hypotonic type of dehydration. So it usually does not happen in isotonic varieties, which is the most common one. It usually happens in the
Hypertonic, I
hypotonic,
guess.
where the sodium levels fall down. The reason is already because sodium is low, most of the fluid goes into the brain cells. Already the brain edema is there. And once you correct the volume loss suddenly, very fast, the fluid inside the cells comes out because the sodium is increased, and it will lead to common complication called as central pontine myelinosis. The other thing that can happen when you correct rapidly is pulmonary edema, sudden overvolume, and you can patient could go into severe respiratory distress because of pulmonary edema.
Yes.
As we told last time, in kidney disease patients, always the volume of replacement will be in small aliquots rather than sudden bolus.
Yes. Yes.
The essential role of oral dehydration therapy is as effective as IV fluid for moderately dehydrated patients' rehydration.
That's one important point. Before the
Yes, sir.
oral rehydration solution was available, almost 10 million children below the age of 5 years used to die
Yes.
just because of dehydration. So once these became available even in primary health centers and almost in most of the rural settings, if the child is able to drink without much of vomiting, initial therapy with oral rehydration has saved a lot of lives.
Lot of
That
lives.
has become the lifeline of initial dehydration, especially in children.
Among pediatric, yes.
Yeah.
Now let's see the potential complication of dehydration. Hypotension or hypovolemic shock, decreased cardiac output, decreased perfusion to tissues or organs, decreased renal perfusion, etc.
So I think these are the potential drawbacks of dehydration, sir, as we are discussing, if left untreated. I think, yes.
These complications are mostly related to the intravascular volume.
Yes, sir.
When you have failed to correct the adequate volume, then hypotension sets in where it causes a decrease in cardiac output.
Yes.
Once the cardiac output comes down, volume to all tissues is much less. It becomes lower and lower, affecting the function of the cells. And mostly because of this ischemia, lactate or lactic acidosis ensures. That causes the function of the cells to further deteriorate. Then they'll cause sudden hepatic shock, sudden muscle shock, and these can lead to electrolyte imbalances, which can cause arrhythmias in the heart, and it can lead to an asystole. Or this can also go on and cause strokes and unconscious states.
Yeah, so we have come to the end of the discussion, and as people are nowadays very much smart, and they are all aware that these preventive steps to be taken while they contract the first sign of dehydration. Yes, we have been talking a lot of topics about the dehydration. Stay hydrated, monitor urine color, all that. These points are very important. I think, sir, you will also agree that these preventive points are very necessary and satisfactory. The last message you would want to give.
These are very important. Actually, these are the ones which prevent us from going into a state of severe dehydration and end up being in the hospital. As they have mentioned, staying hydrated, having frequent sips of liquids. Water is the most important thing. You can probably have coconut water, fruit juices, but avoid carbonated drinks, avoid caffeine, avoid tea, which will lead to more dehydration later. Then, especially in summers, avoiding going out between 12 and 4 is very important. Even if you have to go out, probably constant sipping of water and probably sponging your skin with water is very important. And especially wearing loose-fitting, light-colored clothes are very important to prevent dehydration. These are all common steps which we should follow to prevent dehydration.
So thank you so much, sir, for your very, very precious and very valuable time. And thank you to you, Alice, as well. We
Thank
end the
you.
session.
Thank you, Alice and Dr.
Thank you,
Shanti.
sir.
Thank you.
Thank you, sir. Thank
Thank
you.
you.